Hey, everybody, welcome back to another episode of Confessions of a Male Gynecologist. I am your host du jour. Well, I'm your host all the time. Dr. Shawn Tassone, coming from Austin, Texas, integrative gynecology, and sorry, I have an itch here, and hormone master, hormone Jesus, practicing in Austin, Texas. So I'm licensed currently in about 42 states. So if you live in the United States or Guam, I think I'm even in Guam now, and you want an appointment, you call the office 512-956-0296. Staff will get you registered. We can order labs anywhere in the country. If you don't have insurance, the labs that we draw are about $180 if we use full script. So we try to make it affordable for you. I don't take insurance, or else I wouldn't be able to run my office. But usually you only have to check in with me every 6 months, get your hormones balanced. I'll make some supplement recommendations. Usually I can save you enough on saving you money on the supplements you're already taking, because most of the time you don't need half of what you're using. And that pretty much pays for your visit with me in total. I'm the author of the Hormone Balance Bible. The Hormone Balance Bible is available on Amazon. It's a great primer for those of you in perimenopause, menopause that are wanting to get more information about hormones. It is a tour de force, 500 pages, talks about testing, talks about each hormone individually. And then I also have 12 of the most common hormone imbalances, and I break those down into archetypes, meaning storylines. So estrogen dominance, the queen, low functioning thyroid, the underdog. And I put these into stories with patient stories. And then I have a 6-step shines protocol to fix all 6 of the, to fix those hormone imbalances, spiritual practices, hormones, infoceuticals, nutrition, exercise, and supplements. So it's a great book. If you don't have it, head over to Amazon. I think right now it's $14. It's a great reference to have, and I appreciate your support. So what are we talking about today? Well, I want to talk about something that I hear a lot about, called perimenopause. And the first thing I want to say about perimenopause is that perimenopause is not a disease, meaning it's not a diagnosis. And what I mean by that is that if you go into your doctor and you say, I have perimenopause, they're just going to stare at you, because there's no fix for perimenopause, but there's fixes for the symptoms you're having. So while all these influencers are out there saying perimenopause this, perimenopause that, I'll fix this and that, that's not the way that doctors speak. And those of you that listen to me, I get this question all the time. How do I talk to my doctor? How do I get my doctor to do this? Well, you don't go in and talk about perimenopause, because to them, it doesn't mean anything. It just means the word peri, around menopause, meaning that you're in your 40s. You want to focus on your symptoms. So you want to focus on the insomnia, the anxiety, the irritability. You want to focus on the fatigue, the weight gain, things like that, because doctors can then work with that. Perimenopause to them is just like, it's just like saying I'm 45. Okay, well, what do you want me to do with that? So that's where I would start. But the title of this episode, Perimenopause isn't PMS on steroids. It's a hormonal identity crisis. And I say that because women that are in this phase, they don't know who they are. They don't know who to talk to. They don't know where to go. And I think as a culture, we have made women believe that they need to suffer. I mean, gosh, look at, if you want to go back to Adam and Eve, Eve was basically the downfall of mankind in the Bible. She ate the apple. She succumbed to the temptation. She tempted the man. And I don't think it's changed much since then, if I'm being perfectly honest. We treat women, even the word hysterectomy. Hyst means uterus. Ectomy means to remove or to cut out. Hyst is also the basis of the word hysteria. For millennia, we have always felt like the uterus is the cause of women's hysteria, when the reality is, I don't think women are any more hysterical than men. They just have more hormonal fluctuations than we do that might put their emotions under a microscope. And so I think as a society, we've made women feel like they should just suck it up and walk on. And thus it causes the identity crisis because women don't know where to go. I've told this story a few times when I was younger, and I was talking to my grandmother, and I said, "Hey, Grandma, what was menopause like for you?" I think at the time she was probably in her early 80s. And she said, "What the hell is menopause?" Because back in her generation, they didn't even talk about it. You're talking about a World War II wife who had to take care of 3 kids while her husband was off fighting the war. She was making bullets. Um, you didn't have a lot of time to complain. And that's the other thing, the word complain. I think women feel like if they say something, they're complaining. Luckily, that's changing, but it causes an identity crisis. And so then you got to look at, well, what's the difference between perimenopause and PMS, premenstrual syndrome or premenstrual dysphoric disorder, which is pretty much PMS on steroids? Perimenopause is a conglomeration of symptoms of which I just talked about. PMS are also symptoms, but usually happens in that stage where you are right after you ovulate, probably the week before you start your period, and it gets better. So you're not suffering the whole month. You just might have 3 or 4 bad days where you're not sleeping, you're miserable, you're bloated, things, you have irregular periods, things like that. Whereas perimenopause can take into account low progesterone, which is also PMS, but maybe low estrogen, thyroid's not functioning as well as it could, and even testosterone. So it's a little bit more expansive than just saying somebody has PMS. And I even think nowadays PMS has gotten a bad rap because it's used a lot in comedy sketches and skits and getting along with your wife, blah, blah, blah. What I want to do in this episode is reframe perimenopause as more than just worsening PMS. I want to try and help you understand the depths of hormonal, physical, and emotional changes. I want to validate your experiences, and I want to give you practical steps that you need for that support. So basically, perimenopause is a thing. It's a stage of life. And that's the way I would look at it. I would look at it as a stage of life, basically from probably 35 to 50, 50 to 55. You are in that that around menopause stage. And so if you've been feeling like an emotional stranger in your own skin, you don't know who you are, you're snapping at people you love, you're forgetting why you walked into a room, you're having night sweats, you're fatigued, you're just moody, and you feel like you're watching your life go by. You're not engaged. You're getting stuff done because that's what women do. You adapt and you do what you got to do. Men, when we get sick, the world is ending. But when women don't feel good, they suck it up because I think that's what we've taught them to do. And yet at the same time, we're not helping them. So I want you to start looking at perimenopause as a hormonal identity crisis, a physical and emotional transition for you, and that it deserves more awareness. It deserves better care. And the way that we do that together is by having you talk about it, men talk about it, and making it more of the public dissertation so that you get the care you need. The rising tide lifts all boats. The more we're talking about it, and there's going to be the outliers out there that blame everything on your adrenal glands, but we can blow them off and really focus on what's going on. So I kind of touched on this a little bit, but let's just define perimenopause. Typically, like I said, it means around menopause, starts in the 30s to mid 40s, and as such will last until you go into menopause. So it will last 10 years, sometimes 5 years. You're getting drops in progesterone. Usually that's probably, in my experience, the hormone that dips first. You'll get people out there talking about how it's progesterone all the time. That's not true because obviously hormones are just as variable as the people that have them. And so some women may have a drop in progesterone, some have a drop in their estrogen. The added stress can affect your adrenal glands, which can affect DHEA and cortisol. The fluctuations, the weight gain, the fatigue can all be coming on due to low functioning thyroid or low testosterone. And While I don't think it's misdiagnosed, because technically it's not a diagnosis, I think you're blown off by practitioners. And I've talked about that before with my colleagues who basically are so busy, they can't sit down with somebody for 20 to 30 minutes and talk about this because they got babies delivering, they got surgeries, and they're not in a situation like I am where this is what I do. And this is how I built my practice in the last 7 years. So try to, get that care that you need, get the labs, get somebody that listens to you. And if you don't have that in your doctor, because people will ask me, well, how do I get my doctor to do this or the other thing or believe me? And my response, as sad as it is that you don't get doctors to do anything because they have practice patterns that they believe are true and that they believe are in your best interest. And they may not be in your best interest, but they think they are. And you're not going to change them. You're never going to change the way the doctor does things unless they're very progressive and they're willing to listen. So find a doctor, find somebody, talk to your friends, go online, find people like me. So why is perimenopause not just PMS on steroids? Well, PMS is, like I said, it's more of a cyclical pattern, whereas perimenopause is that constant hormonal roller coaster. So for reference, PMS tends to be that week prior to your cycle. You're just having those issues, pain, heavy bleeding, cramping. You're miserable. You're snappy, and sometimes women have to plan their lives around those few days because they don't want to be around people. Whereas perimenopause is kind of like that all the time. You're feeling constantly irritated. You have insomnia. You could have vaginal dryness. Your fatigue is persistent, and that's interfering with your life. So the symptoms can appear even if your cycles are regular. So that's the other thing. You'll go into the doctor and you'll say, I think I have perimenopause. And they'll say, why? And you'll give them all these symptoms. And then they'll say, well, your periods are regular. Oh, so what? I mean, while that menstrual cycle is good to be regular and it can be kind of an additional vital sign, if you will, it's not the end all be all. And just because you're having a cycle doesn't mean that something might be off. And this is where we blow women off. We break them down into just their periods. And just like the Menopause Society says, women are vaginal dryness or hot flashes. You can't just define people by a couple of symptoms, but it has an impact on brain chemistry, mood swings, anxiety, memory changes, definitely metabolism and weight distribution, insomnia, sleep quality, and then your overall recovery, libido, and sexual health. We know that people who have sex more frequently tend to live longer, they're happier, they have better relationships. And I have a lot of women that will come into the office and it bothers them that they're not sexually as active as they used to be. They used to have a really great sex life and now they don't. And it doesn't necessarily mean that if I give you testosterone, your sex life is going to just dramatically improve. But if you're fatigued and you don't care and you're feeling meh and you don't like your own skin, well, you're probably not going to be very sexually promiscuous or, you know, aroused because you just don't care. And that's where things can change for you because we can make impacts. I think women are led to believe, oh, we don't check hormones because they fluctuate so much, which is complete bullshit. That is what I call lazy medicine. That's a doctor that just doesn't want to draw the labs because they don't know what to do with them. And they're telling you to get out of their office when they say stuff like that. And if that's the case, just, be nice, thanks, and then use your feet to show them how you feel. Um, what do I mean when I say perimenopause is a identity crisis? Well, as those hormones change, as you change, you start to feel um, low self-esteem. When you have low self-esteem and you don't have energy and you feel kind of blah about yourself, relationships suffer, work can suffer. Ultimately, your confidence can go down. The psychological shift that happens, you could be going through this grief of sorts where you're grieving the loss of your reproductive years. Women that are in their mid 40s, upper 40s, my fiance, for instance, 49. She looks 35, but she's 49. And she's kind of grieving the fact that she may, she's not going to have kids anymore. For men, we don't go through that necessarily. And for most men, they're probably like, yeah, that's great. I don't want to have kids anymore. But for a woman, it's different. And we have to be um, open to that. We have to be able to talk her through that and help her understand that. Um, I'm 57, and when you turn older, when you get older in years, things start to go awry. Eyesight, cholesterol, blood pressure, and you start having things. I got invited to my 40th high school reunion, and there's a list of people that have died. I mean, and there's a list of people that have all these medical problems now that they didn't have when I knew them when they were 18. And so you face the aging thing. You look in the mirror, you don't recognize this person that you're looking at, and so in a way, you redefine your womanhood. And then, as I talked about earlier, there's that social stigma that women feel isolated and unsupported during this transition. Even more so, we obviously know that men and children can do this because men still see you as their partner, and they love you, and they still might think that you look amazing and things like that. You may not feel that way. Kids just want you to be the mom, and they need you to go places and do the things, all while you're feeling miserable, and you may feel unsupported during this transition. And I say this too because a lot of women don't support their sisters. They don't support the women in their lives. They'll even do the same things. Oh, you look amazing. Let's just do this. Let's get through this. But they don't, because they don't know, because maybe they're being told the same things. But I think it's one of those things where a typical patient who comes in perimenopause you just have that look. She's sitting in the exam room chair with her head down. Occasionally there will be tears because my first question when I see patients telemedicine or in the office is, tell me your journey. I want to know, first of all, like what you've done, what you've heard, what you've learned, what you've tried, and then ultimately what led you to me. And when I even ask that question, sometimes I'll get crying because women always say to me, nobody's ever asked me my story. They just want to know what my symptoms are, and they don't want to listen to the story. And the story is important. That's why I wrote my book, The Hormone Balance Bible, because they tell a story. Low progesterone in my book, I use the archetype of the unbalanced heroine because if you remember, there's an author, Joseph Campbell. He wrote a book called The Hero's Journey, where he talks about how a person like Luke Skywalker goes from being this little kid on this farm in Tatooine. Yes, I'm a Star Wars nerd. I saw it like 12 times. And then how he turns into this Jedi, and he's no longer the same person he used to be because he evolves, and he has this hero's journey where he goes on the journey, and he finds his call to action and things like that. In his book, The Hero's Journey, it's all about men. And so I started thinking, well, what is the ultimate the heroine's journey? And that's pregnancy. And pregnancy is very progesterone driven. That's the huge hormone in pregnancy, obviously. And you're unbalanced. So I called it the unbalanced heroine. And a lot of women connect with that. They'll connect with that story. And that's why I use those archetypes. So, what are some of the signs that you might be in perimenopause? Night sweats and hot flashes. That's not just menopause. Sometimes hormone like estrogen does dip during the perimenopausal phase. So think about perimenopause as being a race, and you're at the end of the race, maybe like 10 feet to go. You're not quite through the ribbon. You're almost there, or you're pushing the ribbon with your chest, but it hasn't quite snapped yet, right? That's perimenopause. So you don't have to necessarily wait. It's just so stupid, but the definition of menopause is 12 months without a period, which means so many doctors will wait to diagnose you when you've had 12 months of no periods. You could be miserable for well over a year, years for that matter, before they'll actually give you something. You don't have to wait a year. That's just total lunacy. It's misogyny, in my opinion. So night sweats and hot flashes, heavy or irregular periods. As the engine starts to sputter, you might not have periods every month. Now, heavy regular periods are okay unless you're like soaking a pad an hour. But if you're having heavy irregular periods, that's something you definitely need to get checked out with your doctor. But usually what we'll see in perimenopause, you start spacing out. So you might have a period every 2 or 3 months. You might have one regular for a couple months, then you space 4 months. It's just very erratic. Increased anxiety and irritability, for sure. See this all the time. Women are clamoring to get sleep. Not getting sleep, very anxiety provoking. Knowing in those nighttime hours that you're not going to sleep or that you're going to wake up and you're going to be up for 2 hours. Over time, that causes a lot of anxiety. That's progesterone. Progesterone upregulates a receptor in your brain called GABA. So progesterone breaks down into a metabolite called allopregnenolone. Allopregnenolone upregulates GABA receptors, and then GABA stimulates those receptors and calms you down, helps you sleep. Now, I will have an occasional patient super sensitive to progesterone and can almost have anxiety from the progesterone. Very rare, but can happen. Another few symptoms: brain fog, forgetfulness, can be estrogen, could be thyroid related, could just be simple stress. Now, that's to say you can't remember why you walked into a room, you can't remember where your keys are. Not necessarily you're forgetting your children's names, although I will say my ex-wife used to call my kids by the wrong names all the time. That's usually just because you're stressed, you got a million things going on. And they would always joke with her because she would call them the wrong name. I remember Eddie Murphy had that skit from Raw years ago where the kids thought their names were God damn it and Jesus Christ, excuse me, but I just thought that was hilarious because she used to yell at him all the time. And one day one of the kids ran out in the road and she said, God damn it, get out of the road. And he said, but Mom, I'm Jesus Christ. That kind of thing. That's pretty common. But if you really can't remember, then I would obviously get that checked out. Joint pain gets written off all the time for just being older. Oh, you're just getting older. But forgetfulness, joint pain can also be low estrogen, maybe even thyroid at times. Breast tenderness can happen because the hormones are fluctuating. And as I said, sleep disturbances, especially insomnia, night anxiety, waking up a lot, things like having to go to the bathroom a lot at night, like you're waking up to pee all the time, that can be actually low estrogen. So what can you do? I mean, what do you do about all this? Do you have to suffer? Are there things you can do? Advocate, advocate, advocate. I always say we have two ways of diagnosing things for hormones. We have stories, meaning symptoms, your story, and we have labs. Why doctors say they won't order labs is beyond me. Because why would you practice with one arm tied behind your back if you could use both? And to me, you wouldn't just look at the labs and then say nothing about symptoms. Oh, you have a low functioning thyroid. I'm going to put you on thyroid, but she feels fine. Nobody's going to do that. So why would you just take the story and not use the labs? So always get labs. And when they tell you that they can't do them because they fluctuate all the time, they're just telling you they don't want to do it. It's plain and simple. They're telling you, look, in a nice way, I don't do labs. I don't want to do labs. I just don't find them helpful. Your hormones are fluctuating all the time. Hey, I personally think that's garbage and I think it's lazy. But for that doctor, they don't want to do them. And that's their prerogative. They're doctors, they did their training, and that's how they practice. I don't think it's malpractice. I think it's wrong. I don't think they're making any friends. And yet you're still suffering. There are plenty of doctors out there that will do testing. You can do blood. There's nothing wrong with blood testing. If you have a doctor that knows what they're doing, they will test your blood. I wouldn't spend a lot of money on a Dutch test. I think there's a lot of practitioners out there that aren't actually medical professionals and they can't order blood tests, but they can order something called a Dutch panel. The Dutch panel is a legitimate test, works really well, has a lot of great information, but it's super expensive. And for those of you that don't want to shell out $400 for a test, you can use blood. And usually your insurance will cover it if it's coded properly. So advocate for proper hormone testing. And then look at lifestyle changes. We don't talk about lifestyle changes because they're boring and they're not a quick fix, but things you want to focus on: blood sugar balancing, which goes along with nutrition. I always just tell women, let's not make it super complicated. I think all these extreme diets, carnivore, veganism, whatever they are, those are fringy. And there's absolutely nothing wrong with just eating a well balanced diet. Clean proteins, clean meats, um, protein powders, if you need those. And then getting your glucose or your sugars from your fruits and vegetables. Try to stay away from things that are in boxes and bags because they tend to have a lot of processed garbage in them that you just don't need. They're usually calorically dense, meaning you eat a little bit and it's got a lot of calories in it that you don't need. And I just think eating the colors of the rainbow, it might sound boring, and Lord knows I need to do that myself. So I'm not throwing rocks in glass house here. I'm just kind of giving you what I think could be helpful for you. Strength training, there's absolute gobs of research that the more muscle you have, the better you feel, the longer you live, the less disease processes you have when you age. And I'm not talking that you have to be like Arnold. I have a friend who's this little tiny thing and she's in her 70s and she's teeny tiny and she does a lot of yoga, which is doing body weight resistance training, Pilates, and she lifts weights, and she doesn't lift a lot of weights. She just uses the bar, but for her, that's plenty. And that's keeping her strength up. That's stressing her bones so she can have strong bones going forward. So weight training is essential. Sleep hygiene is probably, in my opinion, one of the most important things you can do for your health. But for a lot of women in perimenopause, it's difficult. Progesterone could be an essential piece. I have a lot of women that use CBD or THC. I have women that use hops. I'm a big advocate of Nature's Way hops because sleep is super important. And then think about when to consider hormonal therapy. But in my opinion, especially in perimenopause, the only way to know if you need a hormone is to know that the hormone is low. And that's the other piece of the puzzle. Let's take testosterone, for example. The testosterone number that matters the most is free testosterone because that's unbound and it's active. If you look at the range on a free testosterone, it's usually 0.2 to 6.4 for a woman. That is a 32-fold range. That is a massive range. Most women I see come in somewhere around 0.7 to 2. Even 2, I could triple that and you might feel a hell of a lot better. But doctors will look at that number and say it's normal. Or they won't even order the free. They'll just order a total, which is a worthless number, really, because the total isn't telling you what's active in your body, but it's still a good number to have. So be persistent, get those labs, and then know that there are a lot of safe options out there for you. I try to get women past this mindset from 20 years ago that hormones are bad for you. Hormones are not bad for you. They're in your body your entire freaking life. And the doctors that are out there saying hormones are bad and they cause cancer and all these things have absolutely no problem putting a girl on birth control pills for 25 years, which is a synthetic estrogen and a synthetic progestin, but they won't put women on a bioidentical hormone that looks like the hormones you've had in your body your entire reproductive life. Doesn't make any sense. So lab testing, the last thing is finding a provider who listens. And really, that's 90% of the battle. Is this provider listening to you? And I know I give these quasi medical professionals a hard time, but sometimes they listen. Most of the time they listen. They're actually good at that. And I think my colleagues, it's interesting. I'm in a Facebook group for doctors, and they're always complaining about these quasi pseudo experts who are out there promoting their courses or their books or whatever, and they have no real medical background. And they're mad because the patients are going to these other providers. And I'll always chime in and say, why do you think they're going to these other providers? It's because you're not listening to them. If we listened better as GYNs and family practitioners, women wouldn't need to go to these doctors. So we're kind of fulfilling our own prophecy, if you will. Finding a provider who listens to you is the key. So that's a brief rundown on perimenopause, some of the symptoms, some of the treatments. Perimenopause isn't your end. In a way, it's just a beginning. It's the start of a new chapter. But you need to feel good going through that chapter. There was a lady that I posted on Instagram the other day saying that you need to go through menopause and suffer, because the only way you evolve is to evolve under pressure. And I just thought that, coming from a woman, was ridiculous, because you don't have to suffer. This is just more of that narrative that women have to suffer because you're a woman. You're not going to learn anything from suffering through menopause. That's just stupid. I don't know what the lesson would be. She doesn't really say what it is, but you can't make a diamond out of coal without pressure. Well, I don't want to be a diamond. I like to be a piece of coal, but I want to feel good. I want to be the best piece. I want to be the best feeling piece of coal out there. So what I want to invite you to do is share this episode with your friends that are in their 30s and 40s. I have a Substack now where I'm going to be sharing a newsletter. If you want to get more information, if you want to follow up on the things I'm saying in this episode, it will be translated in a Substack. And then, like as I said before, I am licensed in about 42 states, and I have women reach out to me all the time. Do you know anybody that's in the Cincinnati area? Well, I'm licensed in Ohio. So call my office, 512-956-0296. I can prescribe hormones in Ohio. I can order labs in Ohio. And then I see you on a Zoom, face to face. We talk, we figure out what's going on. We'll order your labs before the visit, so I have those results when you see me. I'll follow up with you in about 5 or 6 weeks. And then after that, it's only 6 months. So the investment is pretty small. Over a year, it's probably $80 a month if you were to pay it monthly. And I think it's well worth the investment for you. Remember, get the Hormone Balance Bible on Amazon, like $14. It's a great paperweight. You can set it in your bathroom. But there's a quiz in there. If you want to see what your hormonal archetype is right now, you can go to my quiz online. It's 36 weighted questions. It's very in-depth. It will give you an idea based on how you answer the questions. Obviously, it's not blood work, but it is pretty accurate. I've had a lot of women tell me that it was spot on. Answer the questions honestly. You can go to www.tassonemd, TASSONEMD.com/quiz. It's totally free. Yep, I'm going to ask for your email because I want to keep you in the loop. You can get my book on Amazon, The Hormone Balance Bible, and I will talk to you all next week. Thank you so much for listening. Have a good one.